Is there a nagging symptom you keep pushing aside, maybe constant tiredness you blame on stress, or a weird pain that just won't quit? It's easy to think it's probably nothing. But here's a sobering thought. Countless cancer cases are diagnosed late, simply because those early subtle whispers from the body were ignored. Knowing these signs early can literally be the difference between effective treatment and a much harder fight. Are you truly tuned in to what your body might be trying to tell you right now? Let's uncover those crucial warning signs you really can't afford to miss. Let's kick off with fatigue. We all feel tired sometimes after a late night or a hectic week, but this is different. This is an overwhelming exhaustion that sleep doesn't touch. You're drained, like you can't muster the energy for things you used to do without a second thought. Cancer cells can suck up your body's energy, messing with your metabolism or hormones. Cancers like leukemia or lymphoma hit hard here, disrupting your red blood cells that carry oxygen, leaving you wiped out. Stomach or colon cancer might cause hidden bleeding, leading to anemia and that bone-tired feeling. If you've been this exhausted for weeks, no clear reason like stress or sickness, talk to your doctor. It's not about panicking, it's about checking what's up. Next, unexplained weight loss. Dropping a couple pounds after hitting the gym or eating lighter makes sense, but losing 10 pounds or more without trying? That's a signal. Cancer cells grow fast, stealing nutrients and revving up your metabolism, even when you're just sitting there. This happens a lot with pancreatic, stomach, esophagus, or lung cancer. You might not even feel hungry less, it just happens. It's tempting to cheer unexpected weight loss, but if your habits haven't changed and the scale keeps dropping, don't ignore it. A doctor can figure out if it's something serious. Now pain. Your body's got a built-in alarm. Pain tells you something's off. Normally you can trace it, a twisted ankle, a tension headache. But what about pain with no cause that sticks around for weeks or months, not budging with rest or pills? A persistent headache lasting over 2 weeks, especially with blurry vision, dizziness, or seizures, could hint at a brain tumor. Unexplained abdominal pain might point to pancreatic or ovarian issues. And bone pain, deep, aching, worse at night, could mean cancer started in or spread to your bones. If it's new, getting worse, and you can't explain it, don't tough it out. See a doctor to find the source. Changes in bowel or bladder habits are next. Your bathroom routine's unique, but a big lasting shift is worth noticing. Persistent constipation or diarrhea for weeks, or stool that looks different, thinner maybe, could signal colorectal cancer. Blood in your stool, bright red or black and tarry, is a must check. On the flip side, pain when you pee, going more often, a weak stream, or blood in your urine, pink, red, or cola-colored, might mean bladder or prostate cancer. Sure, infections can cause this too, but if it's been weeks or there's blood, don't guess. A doctor can test to sort it out. Skin changes can show up too. Your skin's like a mirror for what's inside. A new mole or one changing. Check the ABCDEs. Asymmetry, irregular border, uneven color, diameter bigger than a pencil eraser, evolving shape or size, could be melanoma. Sores that don't heal in a few weeks on your skin or in your mouth need a look. In your mouth, red or white patches that linger, especially if you smoke or drink a lot, might mean oral cancer. A lump under your skin, breast, testicle, neck, armpit, groin, that's new or growing should be checked, even if most are harmless. Excessive bruising without a bump, or tiny red-purple spots called petechiae, could tie to blood cancers like leukemia. Even a dark streak under your fingernail, especially if it's new or spreads to the cuticle, might be melanoma. These are subtle, but don't brush them off. Then there's a persistent cough or hoarseness. A cough that hangs on for over 2 or 3 weeks, not from a cold or allergies, could be lung cancer. Especially with chest pain or coughing up blood, which is a big red flag. Hoarseness that won't quit might point to larynx or thyroid cancer. And difficulty swallowing, food sticking in your throat or chest getting worse, could mean esophageal or throat cancer. Persistent heartburn or indigestion that meds don't fix might link to stomach or esophageal cancer over time. These can feel minor, like a stubborn bug, but if they last, see a doctor. Tests like X-rays or scopes can spot trouble early. Unexplained bleeding or discharge is another big one. Blood in your stool or urine we've covered, always a reason to act. Unusual vaginal bleeding between periods after menopause or super heavy could signal cervical or uterine cancer. Nipple discharge, especially bloody or from one breast, needs checking for breast cancer. It's easy to think, it's just a fluke. But if it's new or keeps happening, don't wait. Doctors can run simple tests to find the cause. Ignoring it risks letting something grow when it could have been stopped. Lastly, persistent fevers or night sweats. A fever's normal with a bug, but one that sticks around for days or weeks or keeps popping back with no clear reason might tie to lymphoma or leukemia. Night sweats that soak your clothes and sheets, especially with fever or weight loss, can mean the same. Your body's fighting something, and cancer can trigger that. It's not about every hot night. Stress or a warm room can do that. But if it's regular and intense, get it checked. It's a clue worth following up on. Here's the deal. These signs don't scream cancer. Fatigue could be a long week, weight loss a thyroid glitch, pain just a random ache. Most times it's not cancer. But if it's new, lasts weeks, and you can't pin it down, that's your body talking. Doctors have tools, blood work, scans, exams to figure it out. And if you're at risk, older family history, regular checkups can catch it before you feel a thing. Knowledge isn't fear, it's power. Having one or more of these symptoms absolutely does not mean you have cancer. Many other conditions can cause them. But ignoring persistent changes is a risk you don't need to take. Think of these signs as your body raising a flag, asking for attention. The most important takeaway is this: listen to your body. If you notice a change that's new, persistent, and unexplained, don't wait and hope it goes away. Talk to your doctor. Getting checked out provides peace of mind if it's nothing serious, and if it is something that needs attention, finding it early dramatically increases the chances of successful treatment. Being aware and proactive about your health is one of the most powerful things you can do.